Welcome back. Dr. Adam McDonald with Triad Foot and Ankle Center is here with us today. So before the break, we were talking about pedicures. What are some signs people should look out for after a pedicure to indicate if there might be a problem?
A lot of times a common thing that I see after is possibly like an infected nail that happens when maybe the technician got a little bit of the skin or got too deep. So redness and swelling around the nail or any kind of drainage that wasn't there before. The other thing I'd often see too is nail fungus or athlete's foot that develops after, which usually shows a discoloration in the nail or peeling skin. And if you develop any of those things, it's a good idea to have it evaluated by a podiatrist or a physician to see if it needs any further treatment.
So what about ingrown toenails? How can you prevent those?
I usually recommend cutting the nail straight across instead of down into the corner. A lot of times when you cut down into the corner, you may get some of the skin and cause an infection. That causes then swelling and the nail continues to grow down further. And again, if you have something like that, often something you can do simple at home to see if it alleviates it is a soak in like a warm water bath for a few minutes, a couple times a day, and see if that alleviates. And if it doesn't get better in a few days, then having it evaluated is a good idea.
And so what should you do if you think that you might have an ingrown toenail?
Yeah, that's something that we definitely see quite a bit of. I usually see a number of them in a day, and having it evaluated by a podiatrist at Triad Foot and Ankle would be a good idea to take care of it. We can sometimes it's as simple as just trimming part of the cornerback or putting you on antibiotics, and sometimes it requires a procedure in the office to remove the ingrown toenail, either temporarily or permanently.
So here's a question for you. Some people might actually be a little bit embarrassed about it, so I'm going to go ahead and ask the question, what about stinky feet? What causes it, and what can people do to prevent it?
Yeah, it's nothing to be embarrassed about. A lot more people have it than you think. It's usually caused by either a bacterial or a fungal infection on the skin, especially this time of year as we go to warmer weather. Those of us that work in closed shoes all day, especially outside in the summer, it can happen very easily with. So people that have a lot of sweat on their feet, it's a good idea to change socks midday through your work shift sometimes, and that keeps those areas dry because those types of bacteria and fungus love to thrive in a warm, moist environment. Hygiene is where it all starts too. Washing between the toes and drying really well between the toes is important, and sometimes that means more than once a day. Sometimes it requires either an over-the-counter antibacterial ointment or even an antifungal ointment. And then if those things don't get better, having it evaluated for prescription may be necessary too.
So washing the feet multiple times a day can help with that stinky smell.
Yep.
Dr. McDonald, you know, it's getting warmer outside. A lot of people probably like walking outside without their shoes on. Maybe they like walking inside the house without shoes. Are there any concerns or dangers when going barefoot?
I think in healthy patients that don't have either, like I said, diabetes or circulation issues, same thing with pedicures, that going barefoot is okay if you don't have those conditions. Those patients that do have those conditions, you want to be cautious with and almost never go barefoot because you could step on something, cause an infection. My general rule of thumb for most patients too, if you're comfortable doing it, it's usually okay. But if you're having pain or having issues with your foot, then going barefoot is probably not going to help those things.
Mm, mm. So if someone is thinking, my issues, you know, they aren't bad enough to see a doctor, or I think it's going to be better, you know, let me put some ice on it. What would you say to those folks?
I think it's great to try those things. That's what I do when I have an injury. But if those things aren't getting better, having it evaluated is a good idea because the longer you delay, the more serious these things can get, and turn from a small issue that is short term into a longer term issue that could have permanent damage. I see that a lot with heel pain or tendonitis, where someone has an issue that they start doing stretching and icing and it gets better temporarily, but then it comes back and you kind of ignore it and put it off because you're busy with work or other responsibilities. And then long term, that can turn into irreversible damage in the joint or in a tendon. And you don't want to have those things because they're much easier to treat sooner rather than later.
And, you know, just how quickly could someone get an appointment with Cone Health with a podiatrist to address foot health concerns? Kind of explain that process.
For any kind of urgent or emergent issues, we have same-day appointments. If you go to our website at triadfoot.com, it's got all our office locations listed. We're in Greensboro, Burlington, Kernersville, and Asheboro, and we've got a number of doctors that have availability each day for urgent or emergent appointments.
And is a referral needed for that if someone wants to go ahead and take that next step?
It typically depends on an insurance plan, on what your coverage is. if it requires a referral or not, but our schedulers will be able to look into that information for you and decide that and let you know when you call. And we can usually help with that process as well.
Awesome. Well, thank you so much. We definitely learned a lot today. And if you miss any of today's segment, head over to the To Your Wellbeing section of our website on WFNYnews2.com.